Hello, my name is Marian. Welcome back to my channel. If you have been here before, if you are new, I work in radiology and I do a lot of videos on CT registry review, and I plan to have more in the future on other parts of radiology. But for this video, I am going to talk about the pros and cons of working in MRI if you are thinking about training or going back to school for it. The topics in this video, I'm going to tell you just a little bit about myself, a brief overview of MRI, talk about MRI school, your schedule, pros and cons. Just a little bit about myself. My name is Marian. I do work in radiology. I've been in this field for about 10 years. I am certified to work in X-ray, CT, MRI, mammography, and breast ultrasound. So in this video, I'm just going to tell you a little bit about MRI and the pros and cons if you are thinking about joining. Just a brief summary about MRI. It's a large magnet machine. It kind of looks similar to a CT machine because it has that round circle or donut. Since it is loud, we do have to give patients earplugs and or headphones with music to help block out the sound. It is attracted to metal objects and devices. So if you do have your phone, pacemaker stimulators, any type of car keys that has a battery to it, credit cards, it can get destroyed. But if you do have a pacemaker or stimulator, we have to make sure that it is in a correct mode to undergo MRI, or if it's even okay for you to even be in the room for MRI. So if you are thinking about joining MRI, just make sure you do not have a pacemaker, stimulator, or hearing aids yourself for medical reasons, because you won't be able to work as an MRI tech. The scans are pretty long. It takes about 30 minutes to an hour to perform those MRI exams. Whether or not we are using contrast, that determines how long it takes. If we are not using contrast, it may take about 20-30 minutes depending on what type of exam we're doing. You can do anything from your brain down to your feet in MRI. A lot of patients are claustrophobic, or some of them are. So you have to just keep talking to them. You have to tell the patients to hold still, because if they move, then the time goes up. So if they're moving, then their scan will not take 30 minutes anymore. It may take 40 minutes. For MRI school, you have different options. You can go back to school for a 1-year program if you are registered with ART as a radiology technologist. If you do not have a license in X-ray, then your program may range anywhere from a year and a half to 2 years, give or take. You can also do those self-study courses for MRI. I know with ART, you can just obtain 16 hours of continuing education credits, and that will satisfy your educational requirements. And then you would just have your job or find a clinical site to get your numbers in. And there are classes that is offered 100% online. When I did my MRI program, I did mine online, but you can also go in person as well. For your typical MRI work schedule, it ranges from 8 hours, 10 hours, 12 hours. You can work days, evenings, or nights. You can work weekends in a hospital, outpatient clinical setting. Depending on where you work at, a lot of MRI techs do have to take call. So if you don't know what that is, pretty much your supervisor may give you a week of call, or maybe 1 or 2 days out the week to do call. And what happens is you will hold your phone or pager, and if a stat brain MRI get ordered in the middle of the night, um, let's say 2 o'clock in the morning, if they feel like it's a stat, then you have to come in if they call you in. So if your shift starts at 7 a.m. and someone call you at 1 or 2 o'clock in the morning to come and do a stat exam, you have to come in if you are on call. So I'll explain that a little bit more in the later slides of the video, just to give you some pros and cons of taking those on-call work hours. But depending on where you work at, you may not have a choice. It may be part of your job duty to take call. For your examination schedule, it can be slow, it can be busy. This all depends on what type of facility you work at, how fast or how slow that facility is, the patient volume. So a patient probably will come in every 30 minutes, or you may not see a patient for every other hour, depending on if you are at a slower facility. Whenever you are working alone, I know in MRI, most of the time, majority of the time, there is only one tech to a machine. So you're working alone a lot of the time. You may have a place where they have two MRI techs, or they may have one that is overlapping a shift. So you may see another MRI tech or work with another MRI tech for about 2 to 3 hours or an hour or so. You may work with them the entire shift. You may be the only MRI tech on the shift. So let's talk about the pros and cons if you are working by yourself. For the pros, it will be good if you are an introvert. If you like being by yourself, really don't like to talk a lot, then MRI is good for you because you get to work alone. You don't feel rushed because you have control over your own schedule. You have control over your own workflow. So if you make a mistake, then that mistake is on you. It's not on anyone else. It's your mistake because you're working by yourself. Now, the cons of working alone, if you are not comfortable with performing certain examinations, then you're by yourself and you don't have help. Those exams that do not come in as often, if you're not comfortable or you're not sure of how to do it, then you're by yourself. You may have to call someone. You may have to look on the internet to see how you scan it. So that's a con if you're working by yourself. Another thing is if you're working by yourself and you do not know how to start IVs, then a patient may have to reschedule, or you may get far behind on your schedule if you have a patient who is a hard stick. So there's another thing to think about whenever you are working in MRI is working alone. Now, the on-call hours I was talking about, a lot of places may or may not require this. It all depends on what type of facility you work for. So, like I was saying, on call is whenever you're scheduled to answer your phone or answer a pager, maybe on the weekend, maybe 24 hours, or for, let's say, 8 hours in the middle of the night. Depending on your supervisor and the way the rotation goes, they may want you to take a call 2 times a week, 1 time a week, maybe the entire week, maybe every 6 weeks to a month. It just depends. So for the pros, you get extra money. You like to have something to do, so you can go out and take call if you are bored. Maybe you like overtime. You may even like working extra hours if you are saving up for a trip. You like the extra money. Then call is for you because you get paid extra. Now, the cons, if you are on call, you are pretty much restricted. So you can't go anywhere pretty much for that day. You have to stay around the house. Or if you do go anywhere, you can't go far because if they call you, then some facilities make you respond to call within 30 minutes to an hour. You have to be at the hospital or at the place to do that exam or even be in the building. So if you are on call, you cannot go out of town. You may have to stay up late, or you may have to be called in the middle of the night. So that's going to alter your plans. But if you are the type of person who do not mind taking call, you like to work extra hours, then this is for you then. It's not a deal breaker. Whenever you work in MRI, you have to watch people very carefully. That means the patients, your co-workers, other healthcare workers. You have to watch them because that machine is very powerful. They cannot just bring anything in a room. So on the door of each MRI facility or room, you're going to have different warning signs to remind people and patients not to bring certain things in. And also, if you have a claustrophobic patient or a patient that is mentally altered, you have to watch them and listen very carefully to make sure that they are not trying to crawl out of the MRI scanner or roll out the table. Sometimes that happens if someone panics or if someone is not, mentally there. If they are mentally altered, it's no telling what they may do, where they may think they are. So that's another thing you got to be mindful of. You can't take your eyes off the patient. You have to get very comfortable in MRI with reviewing the MRI screening form, talking to your patient, verifying what they put on the paper, those yes and no answers. You may have someone that tell you, I filled this out already. I already filled this out. You still have to go through the screening form questions with them because they may have accidentally checked no, but the answer should have been yes. So also look at the paper, make sure that they know what to remove, what not to bring in, what they can bring in. This is when you tell the patient to change into a hospital gown and scrubs to avoid them bringing something inside the MRI room and possibly getting burned or getting their items destroyed. So with MRI, it's a lot different from other radiology modalities, such as, let's say, X-ray, CT, MRI, ultrasound. MRI is completely different because with those imaging modalities, you can bring whatever you want to in the room, especially as a technologist. You're not limited on what you can bring in the room, but with MRI, you are. So if you are scanning a patient, they need to remove their glasses because they can be attracted to the magnet, watches and phones that can get destroyed, any metallic clips, hearing aids that will get destroyed, that's expensive, even ear pods, glucose monitors if they are diabetic, your credit cards that can get wiped out and destroyed. And even for yourself, if you are an MRI tech or an MRI student and you walk in the room with your watch on, you have your credit cards in your pocket, car keys that you have to have the battery for, that's going to get destroyed. So you have to remove anything and everything away from your pockets, the patient's pockets. You need to wand them, make sure they did not sneak anything in their pockets. So you're pretty much checking your pockets, checking everyone's pockets the entire time you're in MRI. You have those MRI accidents you have to be careful of, making sure that they do not leave any electronic devices on their fingers, on their body. Make sure that they know what is safe and not safe to go inside the MRI room. Getting comfortable with using that handheld detector or that wand to wand your patients, making sure they do not have any metal objects on them. You are going to spend a lot of time in MRI, possibly on a computer, verifying implants, electronic devices, making sure that patients do not have anything in their body or on their body that can come off that is not safe to go inside the MRI room. For an example of glucose monitor that is on a patient's arm or stomach, that is small, but if you forget to ask the patient if they have one or if they forget to take it off, they can get burned or it can get destroyed. Their medicine will not get monitored accurately. So it's just different things you have to look out for whenever you work in MRI. No metallic devices, no electronic devices. If you do have those, or if a patient does have those, we have to make sure that they are okay to go inside the MRI room and that you have to use the appropriate camera for them. So it's a lot of things that go into working as MRI. Another thing in MRI, you have to get comfortable with changing your patients. You may have someone who say, why do I have to change? The last tech didn't make me change. So you have to tell them it's for your safety. We want to make sure that you do not have on anything that can get destroyed or that can burn you, any type of metallic fibers. So have all of your patients change. If you work at a hospital, give them a gown, give them scrubs. If you work at a clinic, give them scrubs or give them a gown. Whatever you have, Let them change out of their clothes that they came in with and put them in the company clothes, which is a hospital gown or scrubs. Another thing when working in MRI you have to think about, we are not just button pushers. A lot of times someone may walk by the MRI room and see that we're sitting down and think we're just pushing a button, but that's not true. You have to have your eyes and ears on the patient at all times. You are setting up for the next scan. You are scanning a patient for 30 minutes, setting up their next set of pictures. You have to scan in medical history paperwork, review information on your next patient to make sure they do not have a pacemaker, stimulator, anything in their body that's not safe. So someone may think MRI techs is just sitting down for 30 minutes pushing buttons. That's not true. Overall, how is MRI? MRI is a great career if you are focused and if you do not get distracted easily. You have to protect your patients, have to protect other healthcare workers and yourself from any type of accidents and injuries. A lot of patients are claustrophobic, so you have to have patience, you have to be compassionate in order to work in MRI. You have to be able to pay attention to fine details. So if you're that type of person, then MRI is for you. If you are thinking about MRI school, feel free to leave a comment if you have any questions. If you want me to make a video on how I passed my MRI school and registry, please let me know. Thank you all for watching.